So I did cardiovascular disease. Cardiovascular disease concerns itself with that of the heart and the surrounding blood vessels. And this kind of disorder deals with coronary heart disease, cerebrovascular, and rheumatic, among others. Most of the time, these disorders develop from heart attacks and strokes, and is considered the leading cause of death at around 18 million per year. And it typically stems from factors such as diet, exercise, and substance abuse. And compared to cancer is about 32% for men and 21% for women. But CVD is about 16 for men and about 10% for women. So it's definitely not as high as cancer, but it does affect a lot of people. There are no symptoms when it comes to cardiovascular disease, but again, the first common signs are going to be, well, not signs, but things that will happen will consist of like a heart attack or a stroke or any of those problems when it comes to breathing, feeling ill, fatigue, being a little bit more pale than normal, and breaking out into random cold sweats. The most common symptom is a sudden weakness, whether that be in the arms, the legs, any kind of brain fog, eye issues, loss of balance, anything like that. Very similar to stroke, obviously. And the basic treatment as of right now is to reduce substance abuse and partake in a healthier lifestyle when it comes to food and physical activity. So this would be, even if it's just walking a mile a day, going to work out, it's going to be eating healthier food, cutting out like a lot of sugar and heavy carbs and really bad things for your body. No smoking, less alcohol, those kinds of things. It's pretty much the basic standard of care, and it's where health system is able to counteract these problems as well in the hospital and not just at home. Health systems have said that when it comes to the social and economic cost of cardiovascular disease, it could be eliminated by reducing the risk factors that I just mentioned. And in the study published by Lippincott, there were race differences where black people are more likely to go to counseling for a healthier lifestyle than white people. Within this, younger people are not as likely compared to older people aged 45 to 64 when it comes to counseling. So black people typically more or less are going to be able to go get checked out a lot quicker than white people. And personally, I feel like a lot of white people just think that it's just a simple, basic thing that can be fixed when it is an overall more serious issue. You could take me, for instance. I'm getting still sick, and I've been sick for a month and a half, and I'm just now going to the doctor. Thought I would get better. It didn't. Now I'm going. Sometimes people can miss out on a certain routine of care that is provided, and it can reduce those risks that I had mentioned previously for CVD. Black people are also said to experience higher rates when it comes to being hospitalized and experiencing these issues at an earlier age than white people do. They're not sure why people experience this earlier than white people, but it could be due to, economic and, education level, all of the things. It can really put a damper on that. When it comes to research and technology, the AHA, American Heart Association, every year progress is being made continuously on how to better these symptoms and treatments. And the most promising was a technological improvement to help restore blood flow in the arteries. So this is called zilebesiran. I probably butchered that. But it helped in suppressing hypertension, and that is something that can lead to all these heart issues, and it's probably one of the main things. A thrombectomy has become quite common for those who have blood clots in arteries and needs removing. This is one of those practice, always improving kind of things. And in angiography helps assist doctors when they need to place a stent in blood vessels, but the challenging part about this is that these blood vessels can be too narrow, or it can be full of lesions or built up plaque, so they're not able to work through it. So advancing this kind of x-ray can help them pinpoint the direction that they need to go in the very small vessel and how to get around the lesions and the plaque. Even some diabetes drugs have been shown to help those with heart issues, and it helps those without diabetes. So it's a pro for both sides, and these are glucose lowering drugs, or specifically a semaglutide. It's a long-term weight medication that has been seen to help diabetics and their heart issues. When dealing with CVD and other heart-related illnesses, it can affect not only your heart, but your mood, anxiety levels, PTSD, chronic illness, and stress. And these are all considered risk factors for getting CVD, among other heart-related illnesses. Over time, these risks can heighten cardiovascular activity, like your metabolism and cortisol, which is something we do not want to do. These risk factors can also bring about unhealthy habits like substance abuse, not being active, eating an unhealthy diet, and not taking certain prescribed medications. And this in part is due to one's inability to healthily cope with what's going on and how to fix it and how to prevent it. These kinds of illnesses can be long-term or short-term and can interfere with all aspects of one's life. Research shows that these risk factors mentioned above can start to develop after a stroke, heart attack, or heart failure. And these can stem from pain, fear of dying, and even the financial problems associated with this CVD.